Today topic of discussion is parvovirus. This parvovirus is also known as Erythrovirus B19. Now we will discuss that morphology. It is a very small virus, size 22 nanometer, non-enveloped virus having single standard DNA genome. Genome is negative strand DNA. Capsid has isosahedral symmetry. There is only one serotype. So this one is very small virus, 22 nanometer in size, non-enveloped, negative strand, single standard DNA genome. Capsid has isosahedral, only one serotype. Transmission and epidemiology of parvovirus. This virus primarily transmitted by respiratory route. Transplacental transmission also occur. Blood transfusion can also transmit this virus. So, three main route: respiratory, transplacental, and blood transfusion. This epidemiology infection occur worldwide. Human or natural reservoir of this virus. Animal not source of human infection. So, a human or natural reservoir of this virus. Animal not source of human infection. Pathogenesis. B19 virus infect primarily two type of the cell. First one is erythroblast or RBC precursor in bone marrow which account for aplastic anemia. First one is erythroblast RBC precursor in bone marrow which account for aplastic anemia. Second type of cell, endothelial cell in blood vessels which account for rashes associated with erythema infection. Immune complexes composed of virus and IgM-IgG also contribute to pathogenesis of diseases. Infection provide lifelong immunity against reinfection. Next, clinical finding. There are 5 important clinical manifestations. First one is which include erythema infection, aplastic anemia, fetal infection, arthritis, and chronic B19 infection. For what are the 5 important clinical manifestations? Erythema infection, aplastic anemia, fetal infection, arthritis, chronic B19 infection. So first one is erythema infection. It is also known as slapped sick syndrome, or it is also known as fifth disease. So it is also known as slapdic syndrome or fifth disease. It is an exanthematous illness. It is an exanthematous illness primarily of childhood. This is a mild disease. It is characterized by bright red rashes, low-grade fever, runny nose, sore throat, and subsequent lazy maculopapular rashes appears on trunk and limbs. Symptoms resolve in about 1 week. Disease in children is also called as fifth disease. So disease in children also called as fifth disease. Second, aplastic anemia. Children with chronic anemia such as sickle cell anemia, thalassemia, spherocytosis can have transient but severe aplastic anemia when infected with B19 virus. And people with a normal red blood cell do not have clinically anemia, although their red blood cells precursor are infected. So aplastic anemia, children with chronic anemia. such as sickle cell anemia, thalassemia, and spherocytosis can have transient but severe aplastic anemia. This one, red blood cells precursors are infected. Third one is fetal infection. If a woman is infected with the B19 virus during first or second trimester of pregnancy, virus may cross placenta and infect the fetus. If infection first time trimester occur, it is associated during first trimester fetal death occur. Infection during second trimester leads to hydrops fetalis. So infection during second time the trimester leads to hydrops fetalis. Third trimester infection do not result in important clinical finding. A B19 viral infection in adult, especially in women, can cause arthritis involving small joint of hands and feet bilaterally. This one resembles rheumatoid arthritis. So, fourth condition, arthritis infection in adult woman involving small joints of hand and feet resembles rheumatoid arthritis. Chronic B19 infection, fifth one, people with immunodeficiency, especially for HIV infection, chemotherapy patient and transplantation can have chronic anemia, leukopenia, thrombocytopenia as a result of B19 infection. So chronic B19 infection, people with deficiency. Okay, so HIV infection, chemotherapy patient and transplantation. We have chronic anemia, leukopenia and thrombocytopenia. Next, laboratory diagnosis. Fifth disease or aplastic anemia usually diagnosed by detecting IgM antibodies. Throat swab can also be taken for isolation, but this is not usually done. In immunocompromised patient, PCR is done because antibody may not be detectable in this patient. Then fetal infection can be determined by PCR analysis of amniotic fluid. Then treatment management. There is no specific treatment for B19 infection is available. No vaccine, no chemoprophylaxis. Pooled immunoglobulin may have beneficial effect on chronic B19 infection in immunocompromised patient. Thanks for watching.